You're watching CTOM TV. Knowledge is power.
Before you do any molecular testing, you have to have a biopsy. You don't always have to have a biopsy. There's a lot, tumor DNA sequencing can be done through blood, and there's benefits and disadvantages to both approaches. We like to start with a biopsy sample because it gives us the most amount of DNA. And then we like to use a liquid-based approach if the disease comes back many years later, because it detects emerging mutations that may only occur in certain tumors. So one of the problems, especially in Canada right now, is most of the biopsy samples are basically treated kind of as a way for pathologists to look at the cells through a microscope, maybe apply some stains, but they're not really treated with the knowledge that they can be used to extract the DNA and the RNA. And so there's many things that can be done with a biopsy sample or a tumor tissue sample that could protect it and can protect the DNA and the RNA. And that's not always done. They say if you're going to get a biopsy, don't get it on a Friday because it's liable to stick around in the lab over the weekend and not get, put into its proper protective covering, which is referred to as FFPE for the most part. So a lot of the time, the biopsy samples are compromised and they're not as beneficial for RNA and DNA sequencing as we would like them to be. So I think Michelle's brought a great thing here in that 40%, there's new data to show that at least 40% of biopsy samples in Canada and the States, you can't do tumor DNA sequencing on them. It's too degraded. They weren't treated properly. They weren't, the fixation time wasn't adhered to. There's all sorts of pathology guidelines for biopsy samples that are not always followed. So next slide. So one of the problems is some of the large, what we call Illumina-based sequencing panels. There's companies, many companies that are doing tumor DNA sequencing tests right now. I believe Michelle quoted once that there's about 7,000 companies doing tumor DNA sequencing. Some of the larger companies, one of them is Foundation Medicine, another one is Caris. Great tests. They produce these wonderful tests, but they use what's called a hybrid capture technique in obtaining the DNA. And while that produces great data and it's very accurate, it produced at accessing very low, what we call low resolution mutations. In other words, mutations or DNA that occurs at a very low frequency. The problem is 40% of them fail at least. And, it's very frustrating because a lot of times when we order a test through Foundation Medicine or Caris, a lot of times, we'll wait all this time and then they'll come back and say, oh, sorry, the sample failed. We've got nothing. So that's changed. There's a new tumor DNA sequencing protocol now, which is PCR based. And it actually is optimized for these poor samples. So it's a great tool. In fact, we just invested in a lab that does tumor DNA sequencing that uses this technology. It's an incredible technology. It uses robotics. So you just pop the sample into the machine, robot does everything for you. And then, 2-3 days later, you get this mass amount of data. And it's really good because it allows you to use these poor quality biopsy samples that are so common in Canada and the States right now. So, once again, hopefully we'll catch up with our preparation of biopsy handling. I really appreciate the fact that Michelle put this in because it's an important thing. And so if you do have problems with your biopsy sample, give us a call. We'll help sort that out.
Thank you for watching CTOM TV. Subscribe below and stay informed.